So now I'm going to start this topic. So what you know, in our science, previously also I told, in our science there are three kinds of steps has been told. Not only in our science, even in modern science also they have told performing any operation before and that time and afterwards we have to take some measure. That is called the Trividha karma. Trividha means three kinds of steps we have to perform. What are those? Trividha karma, purva karma, pradhana karma, paschat karma iti tad vyadhing pratyupadekshamaha. Usually there is having the operative, that is the pradhan karma, and before that purva karma or pre-operative measure, and after finishing the operations, okay, then some measures we have to take, because otherwise there is a chances of the any kind of infections or any complication to the patient. That's why it should be taken very cautiously. That is the paschat karma or post-operative procedures. Among them, already Acharya Shushrut given us all the clues how the people can get rid of any kind of infections, viruses, bacteria, everything he has mentioned there. Okay, so what has been told, you see, usually in modern science, if I am going to explain you, then you can understand very easily what is happening. You see, one patient came, okay, so you have seen that she is having all the side symptom which is matching appendicitis, okay, and you have decided you have to go for the operations, okay. So what you are doing, then and there you are telling to the patient that you go and take the admission, tomorrow I'll do the operation. No, it's never be happen. You have to take some measures. So before performing any operation, whatever the measures we are taking, that is purva karma. What we are doing as in our modern science, afterwards I'm telling the Ayurveda Shastra matters.
At first, general health examination should be done. Systemic examinations also is very important, as systemic examination such as respiratory system, any gastrointestinal or hepatic biliary related disorder, that should be noted down. If the patient is having any respiratory disorder as well as asthma, bronchitis, pneumonia tendency, everything should be noted down. As the history of medicine is very important, because sometimes the patients are taking some medicines like hypertensive medicines or any thyroid related or diabetes related medicines in regular basis. That also should be noted down. Sometimes some medicines having some adverse effect towards the patients. Sometimes some patients are becoming allergic towards some antibiotics, penicillin or sulfur related medicines. That should be noted down. Patients having some addictions, that also should be checked properly.
What we are telling, first we are sending the patient for their blood test, because always keep in mind, whenever the exam purpose the question will come, write down the Trividha karma. Sometimes the marks is very much high there, 20 marks like that, it may come 15 marks. So that time not only the Ayurvedic portions, along with the modern part also you have to write, because both are correlated. Anyhow, little bit the measure is different, okay. So first of all you have to understand, this is not the bookish matter, the practical matter. That's why you have to first you have to send the patient for the blood test, to take a routine blood test. She or he, whatever, she is having any sugar or diabetes or any hypertension, for that you have to send for ECG and all. You have to check the BP, okay. And if any case, any urinary problem is there, for that RFT you may send urea, creatinine, whatever. For LFT, okay, liver function test and all. HB percentage is very important, because the patient who is already anemic, for that it is very very dangerous, because you have to keep sometimes restore the blood during the operations. If any time there is having any excess amount of the blood loss, okay, there is the chances of the suddenly, what you know, death of the patient, okay, due to the lack of the blood. Okay, so for that, for this complications, you have to keep ready blood even. So for that you have to send for the CTBT. Okay, CTBT test also have to do. Okay,
Blood test should be sent for CTBT to check the clotting and bleeding time, as well as ESR also, which during any infection showing high level. Should check electrolytes. It is really a vital test to ensure the potassium and sodium levels is in normal range or not. That's also little bit indications of cardiac status too. Should send for the complete blood test or CBC, which shows the total RBC, WBC, platelet status. Specific tests like chest X-ray, ECG, 2D Cochrane, urine culture, blood gas analysis should be done.
And then along with, usually we are doing like that, and if necessary, along with any other problems it is associated or not, USG if it is required, because sometimes the patient came for any cyst operation, but along with there is having some gastritic problem or ulcerative colitis, that time again for confirmation you have to send for USG and all. So this is depending upon the patient condition, but in general we are sending for blood test, CTBT, sugar, then ECG is required most of the time.
Chest X-ray is very important to check there is having an emphysema or asthmatic or conditions, okay, of the patient or not. Besides that, MRI, CT scan, USG, that also can be sent for wherever it is applicable and all.
Okay, and afterwards, after all the tests, LFT, RFT, whatever, then along with we are sending, we are counseling the patient, because before any operations the patients are becoming frightening. Okay, so counseling is very important. So those, all these steps are coming for the operative measures in modern Ayurveda. I'm going to tell afterwards. So why you have to counseling? See, if you have given the date to the patient for operation, that 20th you have to come for admission. Before 3 or 4 days you have to call the patient to come and make them intimate each and everything, how the operation would be performed. Not that exactly, that don't be worried, we will try to, like that, so many, whatever the measures you are going to take, everything you have to, little bit you have to explain, just to give them little bit confidence. Okay, this is your duty. This counseling is important to make them little bit confident. Then next step, it is very important, just operation, okay, before 1 day you have to make the patient admit. Sometimes depend upon the weak patient, we are making admit the patient 2 days priorly. Okay, most of the cases we are actually admitting the patient 1 day priorly. Why it is important? After getting admission, then their BP, sugar level, and their hemoglobin rates, everything would be under the concern. So that time we have to monitor properly. Morning time, if they are getting admission just a previous day afternoon, okay, so that time onwards we have to keep everything in a chart. Okay, that is also under the preoperative measures. Even their urine output, how much they are taking the liquids, the all quantities should be written properly over the sheet. Okay, and simultaneously, if the patient is having any diabetic problem, even they are having any hypertension problem, any anemic patient and like that, any respiratory problem is there, asthmatic problem is there, okay, any cardiac problem is there, whatever, even kidney related any problem is there, still whatever it is there, that's monitoring also would be continuing, and the medicine also would be continuing without any resistance. Okay, next very important thing is the patient already you have seen that's having anemic tendency, definitely you have to go for the blood cross matching. What is the blood group? That is very important, and based on that then you can keep ready the blood and all. So blood matching is the very important matter for the patient before priorly the operation. Next, what would be your duty before the operation? You have to stop the food intake, any solid food intake, just 8 hours priorly you have to stop taking any solid food. Okay, sometimes some are referring that only 6 hours before you can stop to take any liquid. Sometimes some people are telling only 4 hours, but usually it has been recommended just 6 hours. Okay, first of all, their all monitoring would be continued, and we have to give the purgatives. That is very important, because during operations, why we are giving the purgatives and why we are making the patient non per mouth? Why it is required? Because there is a chances of the sometimes gastritis and all. Sometimes they are taking some foods, from that also sometimes there is possible to suddenly gaseous or acidity or any kind of vomiting tendency that may occur. That is also doing any complication during the operations. The next day morning we also have to give the purgatives if it's required. That time also we are giving sometimes we are giving some enema. Okay, because I told that empty stomach is important, otherwise there is a chances of sometimes there is a chances of the vomiting and all, some complications may occur. So then we are removing all the jewelry the patients already wear, that we have to removing out. It's very important. Why it is important? First of all, whenever the patient is coming along with some valuable jewelry, after operations, after getting consciousness, if they are accusing the patient, accusing the doctor or the nurses that they have stolen these things, that is the biggest problem, first of all. Second of all, during the operations, it's also creating some problems. Okay, if you are going to do some operations over your hand, any patient's hand, that time the jewelry is residing there, that is also creating some obstacle. Another third one is those materials, this jewelry and all, these are not sterilized, so there is a chances again secondary infection. So all those reasons we are always removing all the jewelry. Not only that, whatever the artificial dentures or artificials, anything is there, some wearing the wigs, someone wearing the dentures. Okay, so those everything we have to keep aside from there, because during unconscious, see, after giving GA, general anesthesia, patient is almost in unconscious conditions, there is a chances suddenly a small very little 2 or 3 dentures are there, suddenly there is a chances to stuck inside the throat areas and all. Okay, so they could not understand even, and there is a chances of the choking, and that may lead the death for the patient. So those are the very important things always we have to keep in our mind. So afterwards, now this all are under the pre-operative measure. Okay, next we have to go for what next we have to the parts savings. That word is very important. Usually whenever we are going for any operations, before that we have to write parts has been saved or part saving has been done properly. This note we have to write. Okay, what it is, you see, you are going to operate any lower abdomen operations or any kind of appendicitis or like that something, or anorectal cases. Okay, there you have to need to clean all the pelvic regions and all, if there is having sometimes the hairs, so that also sometimes causing some disturbances to the doctors, physicians and all. And not only that this is the reason, sometimes due to this sterilizations problem, that also may cause some infections and all. That's why always removing the hairs surrounding, not only the exact operative areas, surrounding all areas where the hairs follicles are very dense and all. Usually we are doing just to avoid any kind of infections and all, and it is not causing any irritation to the doctor even. Next point. After doing that, then we have to tell the patient, after cleaning everything, then they have to wear the specific totally cleaned gown that they have to wear along with the cap. Okay, mask is not required. Mask is not required for patient. Okay, so afterwards we are just before shifting the patient, what we are doing, introducing the IV fluids. It depends upon the situation. If any time any glycosemia, it is very common factor, because that much time they are remaining in the nil per mouth condition. So sometimes that is having the chances of the sudden low of the glucose and sudden unconsciousness or anything may occur. So just to avoid any complications and all, we have to keep ready if in minor cases, and for major cases we have to introduce there and there. This is entirely the preoperative case.